Lyndsay Brown, Dr. Lyndsay Brown, and I'm a research officer on the Future Proofing Study at the Black Dog Institute. I work on the biggest study of adolescent mental health that's ever been run in Australia, and I largely work on the school engagement aspect. So we work with schools around the country because we visit their schools every year to survey their students. I worked as a school teacher for quite a long time after we came to live in Australia from South Africa 13 years ago. And I recognized that one of the key issues for young people in schools was their mental health, and it often got in the way of them being able to perform at their best. And over time, I came to recognize that actually it wasn't that helpful for them to get therapy and counseling only, that we had to look at ways of changing mental health upstream, that we needed to get adolescents mentally well and healthy in a preventative sense. So after I'd been working in schools for some time as an English and society and culture teacher, I decided that I wanted to actually be involved in research that was doing prevention, and that's what the Future Proofing Study does. It looks at how we can engage with young people preventatively, look at ways that we can work out what's really going on for them so that we can make changes in advance so that they then don't present as adolescents with anxiety or depression. We're looking for the risk factors and the protective factors to promote well-being. So in 2017, our chief investigator, Elisa Werner-Seidler, did a study where she looked at how we could engage young people in digital mental health because we couldn't access them through alternative means. There was so much stigmatizing of mental health. There was no lack of access, etc. So we trialed some mental health apps in schools, and they proved to be successful. So then we decided to roll it out en masse, and that's what the Future Proofing Study is. It's got two aspects to it. The one is working at seeing if digital mental health apps can work in schools for young people, and the other is looking at researching in detail with large numbers of people how we can prevent adolescent mental health problems developing in the first place. So we've got this 6,500 young people that we work with in 134 schools around the country, and we visit them once a year, and we assess each and every one of them for 6 years. So we track them longitudinally for 6 years, and then we also obviously look at a comprehensive set of data about them. We ask them more than 500 questions already about their mental health, and then we track them longitudinally and cross-sectionally over 6 years to work out what's really going on for them. So for example, recently we had completed the Year 8 and Year 9 data sets and analyzed them. And we were able to say, okay, if these students in Year 8, this group of them, say 3,000, didn't have anxiety and depression and then had developed anxiety and depression by Year 9, what did they have in common, those students who now did have anxiety and depression? And we found a number of significant risk factors and protective factors that they had in common. And that sets up the process where we can start to say, okay, these are the issues or factors that are making young people vulnerable. And we need to find ways to prevent those vulnerabilities becoming mental health problems. And that's what we're doing at the moment. And we're releasing all that information to schools, to families, to society more broadly to say, these are the things you need to be concerned about with young people if you want to prevent the mental health crisis amongst young people escalating further. So I do a lot of different jobs as a research officer, but one of the key focus areas of my work is school engagement. And that means that I liaise with all our schools, our wellbeing teams, and I visit a lot of schools. And I suppose in a way, that's what really keeps me going. I love that work. I love the human interaction. I love going to work in schools, meeting these wellbeing teams, seeing how committed they are to young people, working with the young people every year. You know, I was at a school yesterday here in Sydney, and I've been at that school for 3 years in a row. And it was just beautiful to see those students again, to see how they've grown, to engage with them, chat to them. and to talk to them about, you know, the study and how important it is that they keep contributing to this. And you get a sense that they feel that they are change agents, that they're making a difference, which they really are, because they aren't going to directly benefit, but their siblings, their cousins, the other younger generation are going to benefit from what it is that they're doing. And I like that sense of community involvement that I see from them, that commitment that young people often have to making a difference, and that empowerment they have. So I like that, and I also like the fact that we work with schools, and schools are where I think social change can really happen. I believe in schools as the most important institutions for young people. And when we work with schools, at least half of the students who identify or flag as vulnerable in our study are then followed up aren't known to the school prior to us being there. And then school counselors then work with all of the students who flag as vulnerable in an ongoing counselling program, which is really important to maintaining the mental health and well-being of young people. And it's amazing I've worked with all different students, year groups, from year 8 all to year 12, because we've got 3 cohorts, and some of our students are now in year 12. The ones who are participating are largely committed to making a difference, otherwise they wouldn't be there every year. And I really value that in their participation. They can recognize that it's making a difference. And because we tell them about all the different engagements that we have with the Department of Health, Department of Education, the government at a federal level, the way we use their data to make a difference, you can see that for them, that gives them a sense of efficacy and purpose, which I really like. I think the ban on phones is complicated. I know young people will find a way around it, that they will essentially be able to communicate via different media, via different devices. I do see that in classes they are distracting. I know when I was a school teacher, it was distracting for young people to have their devices. But at the same time, in some schools that don't have a lot of equipment, that don't have good laptops or resources really, the phones are actually used a lot for research and so on. And also, in my view, the relationship between the teacher and the students is critical, absolutely critical. That's where the learning and change happens in schools. And taking the phones away, or trying to do so, means that teachers are going to be policing that. And as soon as you introduce that policing role for the teachers, there's going to be conflict. And that's in particular what concerns me. I do understand it's complicated for teachers, and there are schools who are doing a really good job of keeping them out of the playground, which is, you know, on some levels an interesting thing to do, because then the kids have to talk. But a lot of young people talk through their phones. They sit with each other. The shy ones in particular, the introverts, children with an autism diagnosis, etc., and they use the phone to connect with other people. So I think schools are going to have a tough time with it, and I think they're going to have to find pathways that are compromises, essentially, as a way of managing this. Yeah. So I should say that our surveys are absolutely confidential. So the parents, the staff, the teachers, the police, they don't find out what the students tell us. And the only thing that teachers or counselors rather would know about is if the students flag as having suicidal thoughts and behavior. Otherwise, all the information that the students give us is stored in a database at the University of New South Wales as medical information, entirely confidentially. So students are very open, and we're very clear when we're there as well that the students need to sit quite far apart from each other to maintain their privacy, not chat about what they're seeing on the screens, etc., so that we can guarantee their anonymity and confidentiality. And so they feel safe, it seems to me, to tell us what's really going on. So for the LGBTQIA plus students, for example, we've got the first data ever coming out at such a grand scale in terms of numbers around this. In year 8, 3.2% of young people identified as trans or gender diverse, and 2% said they prefer not to say. And we're thinking that ultimately those students are also gender questioning. 12.5% were on the rainbow more broadly. Most of those are students are saying to us that they're bisexual or gay. And that's really important information. A lot of young people don't feel safe or have space to talk about that anywhere else. And those young people are showing us that they're there. And also what we're finding is when we correlate our data, and that's what's so wonderful about our studies, that we can correlate information. So we take the LGBT students and we say, okay, how are they doing in terms of a range of different factors? And they're 4 to 6 times more likely to be anxious, depressed, suicidal, and self-harming than students who aren't LGBTQIA+. And that's important information that schools and families and society more broadly need to know about. Because even if we know at a theoretical level that exists, we're actually now giving decision makers the evidence. This is how many of these students there are in your school or your society, and this is what the impact is of discrimination and gender dysphoria, transphobia, homophobia, etc. This is what it's doing to these young people. They're telling us that they're bullied much higher levels than other students. I mean, when we look at their data, they're suffering from a lot of bullying, and they're also feeling less safe at school, less connected to their peers. Those are all important pieces of information that society needs in order to make a difference. So we are advising that the targeted support is provided for LGBTQIA+ students, other minoritized and marginalized students. So, for example, the schools that have a lower ICSI rate, they're basically schools that are in poorer communities with lower numbers of resources, etc. Those students are also identifying or telling us that they're more anxious, more depressed, and struggling more. So it's providing the evidence to decision makers to make a difference. I should say, earlier on you asked me what made me do this work, and I have 19-year-old twins, a girl and a boy, and I've saw over the years how their mental health was impacted by the changes during adolescence, by social pressures, by a range of different things. And it really was a motivating factor for me that I wanted to understand more clearly what was going on for them. But also, I didn't want other parents and young people to have to deal with what I dealt with, that kind of levels of anxiety and depression. And I know much more now that would have helped me as a parent all those years ago to protect them and their mental health far better. They're doing fine now, but we could have had a much easier journey, all of us, in the last 6 or so years, if I'd known then what I know now. Well, along the way, I mean, we're at the early stage of analysis because it's a longitudinal study, but along the way, we provide the data all the time. So we were to the government, Department of Education, Department of Health, schools, teachers, and we provide detailed information. So, for example, the most recent communications we put out a recorded webinar and a poster for students telling young people what they wanted to know when we asked them at schools, what do you want us to tell you about what we're finding? And they told us, and we made a poster and we've sent that out to all the schools. We providing all the information to families and to schools and all the time to Department of Education, Health, etc. We informed the white paper last year that went to the government and is being used, and a paper recently went to them as well that's being used in the steering committees at government level that are looking at how they're going to reshape the school and education system. Our data is, because it's the biggest study that's ever been done in Australia, is being used powerfully by those organizations. So we want to make change. We want society to understand what's going on and to make the requisite changes. For example, in the recent analysis, as I was saying to you earlier, around the risk factors and protective factors, we found that there were some of the key new data coming out is that the factors that young people with anxiety and depression have in common are being female or gender and transgender, being sexuality diverse, gay or bisexual, having unsupported family relationships, being deprived of sleep, not sleeping enough, not sleeping 8+ hours, having peer relationship problems, friendships and bullying and so on. And those two last factors, sleep and the peer relationships, those are modifiable risk factors that society can engage in now. We've presented them with a whole number of strategies that can be used for those schools, families, society to make changes. And we do that all the time. We find out what people want to know. We find out what's missing. Every year we update information. So, for example, at the moment, we're looking at gambling and introducing information or questions into the next studies around gambling and the next surveys, saying to young people, well, how much are you gambling online? What impact is this having? Because apparently it's becoming more of a problem with young people. So it's a very flexible survey system, because every year we can change the surveys we ask, the questions we ask in the surveys, and we're then able to update our information and provide the most up-to-date information to decision makers about what's really going on for young people, so changes can be made. So I think, for me, in 10 years' time, what would really make a difference is if schools could be seen far more holistically. I think it's really important that young people's mental health is seen as completely and absolutely connected with their academic performance, school attendance, and so on. There's a lot of research about that in the world, but actually, schools often are regarded as places where young people go to learn English and maths. And what I think needs to be understood in society is that young people can't learn English and maths well if they're not feeling happy, healthy, connected, if they haven't slept well, etc. So for me, it's about finding new ways to conceptualize schooling. At the moment, schools are assessed in terms of their NATPLAN results and their HSC results. And actually, that's a large part of the problem. Young people are feeling extraordinarily pressurized to perform academically, and that increases anxiety and depression rates significantly. But if there are things that can be done along the way to prevent young people being anxious and depressed, but also if schools can be assessed in terms of the well-being of their young people, and if schools can actually see that as part of their role, and parents can see that as part of the role of schools, then actually schools, which are the most significant institutions for young people, when they're going through that phase, they're becoming who they're going to be. They're in that separation from families to some extent. They're forming peer relationships that are informing their identity. They're individuating, they're separating, they're becoming who they're going to be as young adults. And schools can play an incredibly important role in that, especially if the young people are happy and healthy and well. They've got a lot of sport going on in the school, they're sleeping, they're encouraged to support each other, to make friends, to be kind to each other. They understand what bullying does to their peers, etc. They know not to be a bystander. All of those things, if society can allow schools to be important places where young people go to learn and grow in a holistic sense, then we're going to have a much healthier, happier generation of young people who are actually performing well academically as well. I think the important thing for me about this study, aside from the value of working with schools and young people with this incredibly big data that is representative of the Australian population according to the census, is that we work with young people that in a diverse way. We work across Australia. So we work, next week I'm going to be working in New England. I'm going to places like Gunnedah, Warialda, Glen Innes. We listen to the voices of young people across the country, across all kinds of schools. And that's what's really important. We need to hear from all young people so that we can get a full picture of what's really going on. And the other thing that's important about this study is that everybody that works on it, and there are lots of us, academics, researchers, etc., we're all incredibly passionate about making a difference. It's not just a job for us. It's a calling, it's a passion, it's something we want to do. We want to make a difference. And I think that that's partly what keeps the study so alive and so successful, really. So if there's anyone out there who'd like to connect with us, you can go onto our website, www.futureproofing.org.au, or you can email me, thefutureproofing@blackdog.org.au, and we've also got a lot of resources that are available on our website, and also we can email you more. We've got lots of our early findings available. We've got posters for young people, recorded webinars about our results and findings. We want to disseminate the information as widely as possible so that it can have the most effect. So please contact us, and we'll be very happy to liaise with you and provide you with as much information as you would like. Thank you.